Sage. We are so happy that you are here joining us today, and we have a very special guest for you. So just a couple of reminders of the show. You have that comment section over there so you can continue to engage with us. Our teachers will not be live with us on the screen, but they will be over there chatting with you over in the comment section. So make sure you guys are talking to our teachers or to me or to our guests, but not to each other. All right, here we go, everybody. Welcome to Engage with Sage. All right, as always, Ms. Schaefer, thank you so much for our awesome videos. We love them. Okay, everybody, we have a ton of people here today, and we are so excited. And I know you did not join this show just to see me and hear me talk. So I am going to bring on our special guest. I'm going to let Dr. Hay introduce himself and what he does. And guess what, guys? He is not an actor. This is real-time stuff. So here we go. Dr. Hay, hi, how are you?
Hi, I'm good, thank you. Thanks for having me come on.
Yeah, and I see you have a football shirt and it's orange, so it's a little different than what we're used to here in Kansas City. Where are you located?
I'm actually located in Cleveland. That's why I'm wearing my Cleveland Browns shirt, because we had the pleasure of getting beaten by you guys in the playoffs this past season.
Yes, that was pretty fun for us. Sorry about that.
That's okay. It worked out okay. We were happy to just have a winning season. We don't get those very often.
Well, very cool. Well, Dr. Hay, thank you so much for being here. And as you can see, we have a lot of people that turned out to see you. And so no pressure, right?
No, none at all.
Here we go. Hi, Avocado 13. How are you? Very excited that you're here. All right. So throughout the show, we'll kind of pop up those comments over there because there's a lot of people here that want to chat with you as well. But here, we're going to give you a couple minutes before we start asking you some questions and then you'll answer them. But just a little bit about what you do and kind of your role in your job.
So I work as a physician, and I am specialty trained and work exclusively in the emergency department. So most emergency department physicians, they go through a training program after medical school to learn how to do that job, because it has different activities, a different role than certain other kind of doctors. And so we go through what's called a residency program. It's like an apprenticeship. It's a training program after school. And then from there, we go and work in the emergency department. So we work days and nights, weekends, holidays. We're there 24 hours sometimes. Sometimes we're there 8 or 12. It depends on where you work. But anytime someone comes in and has an emergency and needs to be seen, then you come see us at the hospital.
Wow, that's incredible. And I'm so excited to ask more about you, because I know we talk a lot over here at the Sage Center, how we have a lot of TV shows right now that have doctors in them. How much is it the same? Is it different? How do you think of it when you watch those TV shows, being a real ER doctor?
So back when a show that isn't on anymore called ER came on, it was the first time actually that a TV show was a lot more realistic, because they had a physician who actually was part of the writing process, and he really worked hard to make sure that the things that are up being shown on the TV are accurate. Prior to that, you would have ridiculous scenarios. It would be embarrassing because they'd put an x-ray up, and we have a certain way we look at x-rays. They'd have the x-ray backwards or upside down, and you get these actors saying the words incorrectly. It was kind of silly in the 70s into the 80s. And then in the 90s, ER came out, and it was the first time that it was a bit more realistic. Now, these things all go the same route. They evolve into relationship drama and behind the scenes silliness that really doesn't occur. I mean, any workplace, you're going to have people who fall in love, but these shows like Grey's Anatomy are pretty silly. My wife loves watching that show, and I just chuckle, and a few times I might walk by and catch a quick scene because it's not very realistic. But the TV show is sensationalizing things and trying to make it fun, and so we appreciate that as
So entertaining, right?
absolutely.
Okay, so what we did here, and everybody that's watching and listening, which we have a lot of people that have our live views right now, which is really exciting. But this will also still be recorded and on YouTube for those that are watching live. Welcome. We're so happy you're here. We asked some of our students to ask you some questions. And so that's what we're going to do now. We kind of grabbed a few of those and we're going to ask you those. And then everybody, I know that you know what my favorite part of the show is. So we are going to put Dr. Hay on the hot seat. Yes, he is going to be on the hot seat, and we will take all the questions we can live over in the comments section. So hold off on those questions, write them down, don't forget them as we kind of go through the first part of our show, because then we'll put him on the hot seat. But before we get started, Dr. Hay, I'm going to bring on somebody else on the show who is super, super important to engage with Sage. And here she is, Miss Co. Hi, Miss Co.
Hi, everybody. I got a special word for you today. And Mrs. Rust helped me out to make sure that it applied to our guest speaker. So she and I thought that stethoscope would be a good word for our co-word for today. So all of you out there, make sure you are emailing your Sage teacher, your IQ teacher, the word stethoscope, so you can get your little token, and we'll see which teacher gets the most replies.
Thank you, Miss Co.
Love the drawing.
Yeah,
Thank
she's
you.
so good at that. All right, bye, Miss Co. All right, so here's the fun part. Let's start with Kaylin. Kaylin wanted to know what inspired you to become an ER doctor.
What I enjoy is every day when I go to work, I don't know what kind of day I'm going to have. I could have a very busy day. I could have a very slow day. I might see a lot of one kind of complaint, or I might see a lot of other kind of complaints. I don't have a schedule because we don't schedule ER visits. You come as you need to, and we see you as you arrive. But also when people are really sick, really injured, have serious problems, they come to see us in the emergency department, and that's the part of medicine that I like. For me, it's exciting to have these cases that are challenging, but also urgent or emergent, meaning we have to act quickly and we have to know exactly what to do, because people's lives are many times hanging in the balance. I mean, you get people that come in with cough and cold, but you also get people who come in with real serious problems, strokes and heart attacks, bad accidents, other things where they can't breathe, and all these different problems where we have to jump right in really quickly, make the right decision, and intervene. And you get to do a lot of procedures. You get to also sit down with family and patients and take time to really go over diagnoses. So we get to see a wide range of problems, and at the same time, really kind of get into that exciting, maybe even some people say stressful part of medicine. It's not for everybody, but for certain personalities, we love that stuff.
Awesome. Very cool. Well, thank you so much. And we have a question over here, and if you can just repeat it, because we have some people still coming in live. But can you explain again one more time what your main role as an ER doctor is?
Right. So hospitals have emergency departments, and those emergency departments have doctors and other providers, other healthcare providers that are in that department to see patients that come and need to be seen right away. So the hospital has surgery suites where maybe you've scheduled a surgery, or you have to go to surgery because you have an acute problem or something is wrong right away. There are offices that people go to. There are areas where they can get blood drawn or get x-rays, but the emergency department is where you go when an ambulance picks you up at the house, or if you have an injury somewhere, if you get very sick, or you have certain kind of complaints like chest pain or abdominal pain, or you think someone's having a heart attack or someone's having a stroke. Those are all reasons to come into the emergency department. It's where you think your health is really at risk and you think something bad may be happening, or you're injured, or maybe you cut yourself and need some stitches, as well as a variety of other things. You know, people sometimes have headaches or different kind of pains that need to be evaluated, make sure they're not something life-threatening, and then get treatment and help so that they can go home and feel better.
Very cool. Very cool. All right. Vanessa is a sixth grader here at the Sage Center, and she wants to know, how much education do you need to become a doctor?
It's a pretty long process. You go through obviously 4 years of high school, then you graduate, you go to a college, and those are typically 4-year programs, although depending on how aggressive you are, there are some 3-year programs out there. Then you get into medical school. That is 4 years, no matter which school you get into, although there are some combination schools where you, out of high school, test in, and it's a combination college and medical school. And some of those programs can be 7 years also. So after 4 years of high school, 4 years of college, then you go through 4 years of medical school, and then you start a training program or apprenticeship called residency. And that can be anywhere from 3 years to 7 years. People who go into neurosurgery, for instance, they go through 7 years of training on top of their 8 years of college and medical school. So that's a long time, 15 years before you get out and practice on your own. For me, it was a 3-year training program for emergency medicine. And so a total of 11 years, because you have 8 college, 8 medical school, and 3 training years.
Wow. Do you suggest that they take any classes in high school that would maybe prepare them for the medical school or any kind of program, any colleges or degrees that they should seek in a college?
Any class where you can get college credit, the advanced placement classes, or some high schools like where my kids go to school, they have a joint program with the junior college where they can actually take college level courses while in high school, and it satisfies both the requirements for high school as well as for college. But if you can test out of any basic coursework in college, it is going to just help you. So I know you can do math, you can do English, you can do chemistry and calculus, I should say, instead of math. So I know there are some programs like that, but any sort of advanced placement class will help. But in high school, in terms of preparing to be a doctor, I would just take the classes that you think you'll enjoy. In many ways, it's the last time you're going to have a chance to do that. Because once you get into college, you get a little sort of pigeonholed or directed specifically towards certain courses. And once you're in medical school, you don't get any choice at all.
Oh, that's perfect. Thank you. Look at that. We have somebody out there that wants to be a neurosurgeon. So there you go. Good job, Luke.
All right. Congrats, Luke.
Yeah. All right. Here we got another question for you. How do you make the tough decisions in your job?
Tough decisions. I assume you mean when we have someone come in and they're really sick, maybe that needs a certain problem fixed. A lot of it falls back on our training and our preparation. You could imagine how many things you can learn with all of that schooling and all that time working. So when we go into residency, we're actually working as doctors, but we have another doctor supervising what we do. And so we practice over and over and over again. And we have special labs where we go in and there's a dummy set up to look like a person. And you can start IVs and you can practice all these other procedures that we do in the emergency department so that by the time we leave and our training is complete, we feel very comfortable doing those things. With that being said, there is no easy procedure. You always have to be prepared that if something doesn't go right, what is your plan B and what is your plan C? But that's just through that long training process and just working and studying and practicing over and over again to feel comfortable doing those things.
Wow, great. Thank you so much. Okay, Tristan is also a student here at the Sage Center. How do you deal with stress as an ER doctor?
That's a great question because I've seen some comments here on the side, a lot of people talking about stress. And it is true, you know, if someone comes in and a patient doesn't survive, you have to tell a family member they have cancer. You have to tell someone that they have some serious illness like a stroke or a heart attack, or you have a little kid who unfortunately really gets hurt or passes away from an accident or whatever the case may be. Those are hard times to have conversations with the family, the patients, but also it's hard on us because most of us, you know, we became doctors because we want to help people, we want to take care of people. And so, you know, we're empathetic and it hurts us. So what I stress to myself and my colleagues and coworkers and what I do personally is I make sure I have a good support group, whether it's family or friends or both. I exercise regularly. I make sure I get plenty of sleep, and I try and find activities that I can do to release stress. So I try and get out. And when my kids go sledding or skiing, I go with them. And when we're doing activities, sports outside, if they're throwing the football or playing soccer or swimming, I'm out there doing those things too, because I think exercise is a big way to relieve stress. And then, like I said, having supportive family and friends that you can sit down and talk to, those moments where you're feeling upset or sad or down, that's a good outlet as well.
That's awesome. And those are strategies that everybody that's listening can definitely incorporate in their life. So thank you, Dr. Hay. All right. So Anne would like to know, what skills does it take to be an ER doctor?
I think you have to definitely be driven. It's a challenging process, and you have to work hard to be successful. You have to be one of those people who can kind of adapt to change. Some people are very by the book. If their day doesn't go A through Z, they get off track and they have a tough time. You have to be willing to kind of jump around. It almost helps a little bit to have some ADHD, because you're seeing multiple patients at once. They don't come just one at a time. So you might have 7 or 8 people that you're taking care of, and you might be in the middle of process 1. All of a sudden someone says, Dr. Hey, I need you in room 7. You got to go in there, shut down what you're doing before, open up what you're doing with this patient. You got to be able to jump around a little bit. I think you have to be willing to, put in time to study and train. But at the same time, I think it's important to be empathetic and understand that in the emergency department, a lot of times you're going to be taking care of patients who it's their worst day. And they're going to be grouchy. They're going to be grumpy. They may be mean. They may be homeless. They may be poor. They may be not as smart as you, and they may have a lot of questions. You have to really understand that you're going to see all walks of life. You're going to see people who struggle as well as people who are doing really well. So you have to be open to all those different personalities, all those different patient types, with the understanding that you're there to help them and make sure you're giving them the best care that you can.
Awesome. All right. This is a really interesting question. I don't know if you've ever been asked this one, but Katie wants to know, are there any pet peeves that your patients do that just drive you crazy?
Well, I try and stick with what I just said, and I try not to let what happens in the emergency department drive me nuts. But sometimes patients come in and they're not feeling good, or sometimes they have psychiatric problems where if they are off of their medication, they behave in a way that they wouldn't if they were on their medication. So they're sometimes erratic or mean or aggressive or violent. So a pet peeve of mine is when someone is mean to my staff, my nurses, because the nurses do so much hard work in the emergency department, and they're really the most important factor in the emergency department of how we get great care for our patients. So when I see a patient unnecessarily being rude or mean to my nurses, that bothers me. And I sometimes have to go in and say, hey man, what's going on here, and talk about it and work through it and get them to realize that you just don't treat people like that, especially when they're trying to take care of you.
Yeah, perfect. All right. So this is my favorite part of the show, and it is It is the hot seat, and we already have tons of questions over here, so we're going to pick a few out. I know we won't get to all of them. We have 11 minutes, though, to put you on the hot seat, but I will give you a little heads up. The last question we're going to ask you is any advice or any wisdom that you would give students that are going into the medical field, or just any advice or wisdom for any of our middle school students. All right, but that will be the last question. I'll at least give you a heads up on that one. Since we are about to put you on the hot seat, which the first question is going to be from Ms. Coe. Any funny situations that you have encountered in the ER?
There are, and as middle schoolers, I think you will enjoy this. Without getting too inappropriate, I don't know what it is, but sometimes patients put things in weird places. Their nose, their ear, or sometimes their bottoms. I don't know why this is, but that for us usually makes the staff and me, not in front of the patient, but smile a little bit. But that's pretty silly.
That is pretty funny. All right, and here's another one. What would you do if you didn't work in the ER?
When I was looking at different kind of specialties of emergency medicine or specialties for practice, I really liked orthopedics. That's where, you break a bone, you get to fix it. And I liked it because you work with these tools that look like the same tools you use in your garage at home. And they really are drills and saws and things like that. And I always liked doing those things as a kid. So I thought that would be, something cool to do. So that was my second choice.
Your second choice. Awesome. Okay. Well, here's a good one. And you talked a lot about your patients and being empathetic with them, but we have one from Avocado 13. Have you ever had a new ER doctor mess up on a patient? Are you as empathetic with them?
One thing I've learned in doing this for over 20 years is you never know everything. And a physician who's been working for a few months or someone who's been working for 3 decades can make mistakes. No one is perfect. So what I try and do when I have physicians who treat patients badly, either because they're mean to them or because they make a mistake, is, that doctor has to own up to that and has to apologize for that and recognize that they're not perfect and they made a mistake. And so I, a lot of times have to talk to doctors that work under me as the director and say, hey, you need to call this patient and talk through what happened. Because I think no one is perfect. Everyone has issues with whatever job they do, where they have good days and bad days. But I try and, for those doctors, just trying to help them learn so that they don't make that mistake again, but also reach out to the patient to be honest about what happened. And I find that seems to make everyone pretty happy.
Awesome. So what's great about the hot seat is that not all questions have to do with being an ER doctor. So we're going to go here to Miss Turner. What's your favorite football team other than the Browns?
When I was a kid, I was a big fan of the Washington Redskins. They had the Hogettes on the offensive line. These were fans who dressed up with pig noses and dresses. It was a silly thing back then. Their wide receivers were a bunch of small, fast guys called the Fun Bunch. And they had just won the Super Bowl. And I was at that age, where I was really getting into football, and this team was fun, cool, scored a lot of points, played really well. And where I grew up, I didn't really like the local team, so I followed the Redskins until I moved out here to Cleveland.
There you go. I was really hoping you'd say the Chiefs.
I don't know. I'm still bitter. Still bitter about last month.
So you talk a lot about your job and a lot of time you spend there, and you did talk a little bit about going outside with your family, but we have a student that wants to know a little bit more about your family. Do you mind sharing?
Yeah, I have a wife who I met here in Cleveland, born and raised in Cleveland, and it's the reason why I'm still here, because I was born in Southern California and actually left there to go to college and then moved again to go to medical school. And then I have 3 children, 3 boys, 10, 12, and 15. So one's a freshman in high school, one's in 7th grade, and the 10-year-old, he's got kind of a weird placement of his birthday, so he's in 4th grade. So he's going to be like 25 when he graduates.
And where'd you go to college?
I went to the University of Notre Dame in Indiana, South Bend.
And why did you pick that school to go to?
It was a good school academically. It was very different than where I grew up. It's in the Midwest, and I grew up in Southern California. I love the campus. The campus was beautiful. It's a smaller college, so it's not one of these huge places with like 30,000 students. It has less than 5,000 undergraduates. And I just felt like it offered a lot of things I wanted. It had good academics. It offered opportunity to get into a lot of different careers. So it really fit me wanting to change and where I was living and, try something new as well as go to school that was good.
Very cool. Okay, so we teach a class called Biomedical Engineering, and Miss Russ is a teacher that teaches that, and she wants to know what is the most fascinating thing about the human body that you can share with us.
Turnover and recovery. So you have parts of your body that replenish themselves every 5 to 7 years. And I was just talking to someone else about this. Your hair can go from straight to curly, or wavy, I should say. Your body parts, skin, GI tract, other areas regenerate and regrow. And then it's amazing how much your body can recover on its own. Much of what we do in medicine is just helping to speed along that process or limit things that slow down that process, because your body really will heal itself in a wide variety of problems. And And in many ways, you can do things that eliminate the need to take medication. Exercise, diet, weight control can eliminate a lot of health problems because your body's an unbelievable machine that recovers and repairs itself. It's pretty incredible.
That is awesome. All right, here we go, you guys. Questions are still coming in, and I know I didn't get to all of them. You have been a great audience, so we'll do a couple more, and then you will leave us with your wisdom and advice. So here we go from Miss Torres. Did you ever want to give up when you were going through medical school?
Mrs. Torres, when I graduated from Notre Dame, I actually only applied to a couple medical schools. I was looking at a lot of different programs to figure out what I wanted to do. And so I had actually several years where I was working, living in Chicago, looking at alternative careers before I got into medical school. And I had a lot of people tell me, you should probably look elsewhere. At that time, it was really competitive. It was the most competitive, 5 years to get into medical school for the last 40 years. So it was just a time where a lot of people were applying. A lot of people told me to give up. But I got a job working in a hospital, working with patients, doing pharmaceutical drug trials. I loved it. I loved the patient interaction, and I really ignored everyone's advice to quit and end up getting in and become a physician. So
very cool. Thank you for sharing. Okay, this is a great question, and I kind of was saving it, Alex. Thank you for being patient. Are you ever scared or grossed out when you work on patients?
I am lucky that I don't get grossed out. And we have staff members who, if someone comes in with a toenail problem, or if someone comes in with, something in their nose or other little things, they get grossed out by that stuff. But I'm fortunate enough, none of that stuff bothers me. But yeah, there are times when patients are really sick, they're dying, and my heart beats a little faster and I get a little, I'm not going to say scared, but I definitely get nervous. I think that's normal. And because you want so much to save that patient. So you just have to focus on what you're doing. And I tell my staff all the time, the first breath that you give is to yourself. Take a breath and then go forward, when someone's coming in trouble. So.
Well, that's great advice for anybody in any kind of a hard situation, is just take the first breath as yours. I like that. Well, I want to thank you so much for joining us. Ms. Torres, thank you so much for giving your time and sharing your knowledge with us today. Ms. Turner, thanks you. We have everybody over here sending thank you messages. Here we go. There they go. So any words of wisdom or advice that you would like to share with our middle school students?
The best advice I can give is, as you move forward, no matter what your grade or your age, is continue to be a lifelong learner. And what I mean by that is take the time to read, take the time to listen, take the time to watch, because you always need to be learning something new. As soon as you get settled and kind of stuck in what you do day to day and don't search out new interests and new information, I think you really start to kind of struggle in the day to day, because people lose excitement and other things like that. I talk with my kids and my wife all the time. I'm watching shows on technology or science or history or other things that I've, never previously expressed interest in, just because I want to continue to learn. So I read a lot. I listen to audiobooks when I drive. Doesn't mean I don't listen to music or watch, Fast and Furious or Star Wars. I still try and each day, or at least each week, pick up something new from a knowledge standpoint, just to be well-rounded and a lifelong learner.
Oh, awesome. Thank you so much again. Everybody, thank you so much for watching. We will see you next Wednesday, same time, same place.